Hi, I'm Dr. Gregory Doerr, and this is video for condition of the month, lateral epicondylopathy. And we're going to do the FTMI taping associated with lateral epicondylopathy. Now, the concept with functional taping for musculoskeletal injuries, remember, is finding specifically a tape job that will guarantee success associated with that particular condition. And our algorithm associated with lateral epicondylopathy is relatively simple. When our evaluation is done, we usually find a manual muscle test that's going to create pain in this patient. So in this case, we may say it's just testing the extensor tendons. So we're going to have him hold that extension position, and he's saying, ouch, 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 that creates pain. What we're going to look for next is to see if a fascial pull is going to make that symptom feel better. So we're going to have that same test done. Now I'm going to just lightly touch the skin and pull into a certain direction, test again, pull the skin into a different direction, test again, different direction, test again, different direction, test again, and then I'll start going through oblique angles associated with the fascia. Now at some point the patient's going to say, wow, that really feels very good. If that's the case, we're going to use an SPRT taping associated with lateral epicondylopathy. However, every now and then you may notice that you don't get a fascial pull that makes somebody feel better. Important thing there is we got to go back to our factor treatment. If we've done our factor treatment and the patient now when we manually muscle test gets better, then we want to make sure that we use a neurosensory style of taping just through the extensor and the extensor tendon. However, in light of that, it's not the best tape job associated with lateral epicondylopathy, but if you know you get relief associated with your soft tissue treatment and no fascial pull makes it feel better on manual muscle test, that's the tape job we're going to use. We're going to use a straight neurosensory style of a tape job, which will just be ripping the tape, laying the tape down, and laying it right down while the tissue's in a stretch position. However, most epicondylopathies you're going to notice respond better to an SPRT taping, which is what we're going to show right now. In this case, we'll say our patient had pain on testing, but it felt a lot better when we pulled towards the lateral aspect, and the patient says, yep, I feel a lot better when I manually muscle test. We're going to take our tape, lay it down along the same direction that the fascial pull made it feel better. Then we're going to go to Tim Brown's SPRT tab, the AC tab, approximation compression tab. We're going to lay that tab down right on the extensor group. And again, the important thing associated with tabs is we want to make sure that we place our finger about 1/4 to 1/2 inch in front of the tab and then not over pull the tape. We want to make sure that when we pull the tape, we're just pulling at the tab and laying it down. It should look that easy. You can see the convolution that develops in the skin associated with that. Now we can rip it off and retest to make sure that the patient got, number one, less pain, but two, they'll usually get stronger on the test. So this is, again, our taping for a lateral epicondylopathy using an SPRT style. And the reason we use this tape job as opposed to our straight neurosensory is because we found a fascial pull on a manual muscle test that made the condition feel better. We use the SPRT taping every time we have a fascial pull that makes something feel better. However, in lieu of that, if there is no fascial pull that made it feel better, but our soft tissue treatment improved the condition on a manual muscle test following, we can use a straight neurosensory style of taping along the extensor compartment. Once again, I'm Dr. Gregory Doerr for Functional Soft Tissue, and this is our 4th video, our FTMI taping for lateral epicondylopathy. If you have any interest or questions regarding classes or products, you can always go to functionalsofttissue.com, and I look forward to seeing you at a class soon.